Imagine walking into your horse's stall and realizing something is terribly wrong. Your normally quiet horse is restless, frightened, or unusually aggressive. He may appear to have colic, stumble as though he is neurologic, drool because he cannot swallow, or repeatedly bite at the place where an animal attacked him weeks or even months earlier. These symptoms could have several possible causes, but one of the most dangerous is rabies. Rabies in horses is uncommon, but it is always an emergency. Once a horse develops clinical signs of rabies, the disease is considered fatal. Rabies can also spread from an infected horse to people and other animals, which means one sick horse can create a serious public health investigation involving owners, barn workers, veterinarians, farriers, and anyone else who may have handled the horse. So what is rabies in horses? How do horses become infected? What are the first signs of rabies in a horse? Can a horse transmit rabies to a person? And most importantly, how can horse owners prevent this devastating disease? In this video, we are answering those questions and explaining why a simple annual vaccination is so important. Before we continue, remember that this video is intended for education and cannot diagnose your horse. If your horse suddenly develops abnormal behavior, difficulty swallowing, unexplained aggression, weakness, paralysis, or other neurologic symptoms, keep people and animals away and contact a veterinarian immediately. Do not put your hands inside the horse's mouth. Rabies is an acute viral disease that attacks the nervous system of mammals. Horses, humans, dogs, cats, wildlife, and other mammals can all become affected. The disease is caused by the rabies virus. It travels from the site of exposure through the peripheral nerves toward the spinal cord and brain. Once it reaches the central nervous system, it causes rapidly progressive inflammation of the brain, known as encephalitis. After clinical signs begin, there is no effective treatment for rabies in horses. The disease progresses towards paralysis, respiratory failure, and death. This is what makes prevention so important. Horse owners cannot wait for symptoms to appear and then treat the infection. By that point, it is already too late to save the horse. So how do horses get rabies? Rabies is most commonly transmitted when an infected animal bites a horse and introduces virus containing saliva into the wound. In the United States, potential wildlife sources include bats, raccoons, skunks, and foxes, although the most important carrier varies by region. A horse does not have to live in a remote wilderness area to encounter one of these animals. Wildlife can enter suburban farms, training facilities, backyard pastures, and barns. Bats may enter enclosed buildings, while raccoons, skunks, and foxes may be attracted by feed, garbage, water, or shelter. Because horses investigate unfamiliar objects and animals with their noses, bites may occur around the muzzle and face. Bites can also occur on lower legs when a horse approaches, paws at, or steps near a rabid animal. Unfortunately, the original wound may be extremely small. It can disappear beneath the horse's coat or heal before anyone realizes that an exposure occurred. The incubation period is the time between infection and the appearance of symptoms. In horses, this period can range from days to months. Its length can be influenced by factors such as the location and severity of the bite and the amount of virus introduced. That delay creates a dangerous problem. By the time the horse becomes ill, the owner may have forgotten about a minor wound or may never have known the horse encountered wildlife at all. So what are the symptoms of rabies in horses? There is no single appearance or behavior that identifies every rabid horse. Early symptoms can be vague, and rabies can resemble several more common equine conditions. A horse may initially appear depressed, anxious, restless, or unusually sensitive. Some horses develop a fever or lose their appetite. Others repeatedly lick, rub, bite, or scratch the site of the original wound. As the virus affects the brain and spinal cord, the horse's behavior and movement may change rapidly. Possible signs include unexplained aggression, extreme agitation, hypersensitivity to sound or touch, muscle tremors, weakness, incoordination, stumbling, circling, head pressing, seizures, or progressive paralysis. Some horses may repeatedly lie down and get back up, roll, sweat, paw, or look at their sides. These behaviors can resemble colic. However, a horse with rabies may also display unusual neurologic signs or behavioral changes that do not fit a typical colic case. Rabies can occur in what are commonly described as furious and paralytic forms, although the symptoms do not always fit neatly into one category. In the furious form, a horse may become severely agitated, aggressive, or unpredictable. The horse may bite, strike, kick, charge, or throw itself against walls and fences. This behavior is not disobedience. It is the result of devastating neurologic disease. In the paralytic form, weakness and paralysis may be more prominent. Paralysis of the throat and jaw can cause difficulty swallowing, excessive saliva or drooping lip or jaw, and an apparent inability to eat or drink normally. This presentation can create an especially dangerous situation for people. Someone may assume the horse is choking, has something stuck in its mouth, or needs oral medication. Reaching into the mouth of a horse with an undiagnosed rabies could expose broken skin or mucous membranes to infected saliva. This is why sudden difficulty swallowing, unexplained drooling, abnormal behavior, and neurologic symptoms should always be taken seriously. Keep your face and hands away from the horse's mouth while contacting your veterinarian. Can people catch rabies from a horse? Yes. Horses can transmit rabies to people, primarily when infected saliva enters a bite, an open cut, or the mucous membranes of the eyes, nose, or mouth. Simply standing near a horse is not generally considered a rabies exposure. Touching intact skin is also different from having saliva enter broken skin or a mucosa membrane. However, every suspected exposure must be evaluated by medical and public health professionals. Routine horse care can bring people extremely close to a horse's saliva. Owners may administer oral medication, examine the guns, check for choke, assist with dental care, wipe saliva from the muzzle, or handle a bit covered in saliva. Before rabies is suspected, numerous people may have already handled the horse. That is one reason a single equine rabies case can result in many people being evaluated for post-exposure treatment. If you believe saliva from a potentially rabid animal entered your eyes, nose, mouth, or broken skin, immediately wash the affected area thoroughly with soap and water and contact a healthcare professional and your local or state public health department. Do not wait for the animal's final test results before seeking guidance. How is rabies diagnosed in a horse? Rabies cannot be confirmed in a living horse with a simple barnside test. Its symptoms overlap with colic, choke, trauma, poisoning, and other neurologic diseases, including equine herpes virus, myeloencephalopathy, West Nile virus, and Eastern equine encephalitis. A veterinarian may suspect rabies based on the horse's symptoms, vaccination status, exposure history, and the presence of rabies in local wildlife. However, definitive diagnosis requires laboratory examination of brain tissue after the horse has died or been humanely euthanized. If rabies is suspected, do not transport the horse, move it through the barn, or allow people to continue handling it, unless directed by veterinarian and public health authorities. Isolate the area as safely as possible, keep other animals away, and make a list of everyone who may have had direct contact with the horse or its saliva. Do not attempt to capture or kill a suspected wild animal unless animal control or public health officials direct you to do so. Improper handling could expose another person or damage the tissue needed for rabies testing. Can rabies in horses be prevented? The most important way to prevent rabies in horses is vaccination. The American Association of Equine Practitioners classifies rabies as a core vaccine. Core vaccines protect against diseases with serious health consequences, potential public health significance, or widespread risk. The AAEP recommends that all horses receive a rabies vaccination every year. According to the AAEP, a currently vaccinated horse exposed to a confirmed rabid animal should receive an immediate booster from a veterinarian and be observed for the period required by state public health officials. The situation for an unvaccinated horse can be much more serious. Depending on applicable public health rules, the available options may include immediate euthanasia or strict isolation lasting for months, accompanied by post-exposure vaccination and official monitoring. Owners should contact their veterinarian and state public health officials immediately after any known or suspected exposure. Do not assume that a horse is safe simply because the bite looks minor or the horse appears normal. Vaccination is the strongest defense, but farm management can also reduce the chances of an encounter. Store grain and supplements in wildlife-resistant containers. Clean up spilled feed, secure garbage, and avoid leaving pet food where it attracts raccoons, skunks, or foxes. Repair obvious openings that allow wildlife to enter feed rooms, tack rooms, or enclosed barns. Evaluate barns for possible bat entry points while following wildlife laws and safe exclusion practices. Teach children and visitors never to approach a wild animal behaving strangely. However, remember that a rabid animal does not always appear aggressive. It may seem unusually tame, confused, weak, paralyzed, or active at an unexpected time. Regularly inspect your horse for unexplained punctures, scratches, swelling, or wounds, especially around the muzzle, face, and lower legs. If you find an unexplained bite or discover a bat or suspicious wild animal near your horse, call your veterinarian. Do not wait for symptoms to develop. Dogs and cats living on the property should also remain current on their rabies vaccinations. A complete farm prevention plan includes every susceptible domestic animal, not just horses. It is also wise to keep accurate vaccination records that include the horse's name, vaccine, administration date, veterinarian, and next booster date. In an emergency, I think my horse was vaccinated sometime last year, is not the same as documented current vaccination. The essential answer is simple. Rabies in horses is a viral neurologic disease transmitted mainly through the bite of an infected animal. It can cause behavioral changes, colic-like activity, difficulty swallowing, excessive salivation, aggression, incoordination, weakness, and paralysis. Once clinical signs appear, rabies is fatal, and an infected horse can expose people through its saliva. Because rabies cannot be treated after symptoms begin, prevention must happen before exposure. Vaccinate every horse annually under your veterinarian's guidance. Reduce contact with wildlife. Investigate unexplained bites and immediately report suspicious neurologic symptoms or possible rabies exposure. Rabies may be rare in horses, but rare does not mean impossible. The consequences are simply too severe to ignore. One annual vaccination can help protect your horse, the other animals in your barn, your veterinary team, your family, and everyone who works around that horse. Thank you so much for joining us. And remember, I am not AI. If you listen closely, you can hear me breathing.